Welcome to physicaltherapyvideo.com. I'm Bob Schrupp, a physical therapist. Today we're going to discuss rehabilitation following a knee replacement. And we decided we're going to break this up into three parts. In the first section we're going to discuss some of the general concepts and some of the things you should be keeping in mind after a total knee replacement. And the second section, what I'd like to discuss in that section is the two exercises I think it is critical that you do after you've had your knee replaced. And the third section will be kind of a hodgepodge. We'll discuss additional exercises and additional issues that you might want to address after you've had your surgery. The first thing I want to talk about is with regard to your recovery with rehabilitation, try not to compare yourself to other patients. I hear this all the time, you know, you're leaning across the fence talking to your neighbor, and the neighbor goes, wow, you know, I had my knee replacement and I was dancing within a week. And you know, first off, a lot of them tend to exaggerate and don't remember exactly how it happened. But the second thing is, you just can't compare yourself to another person. In fact, if you have one knee done and then years later have another knee done, I can guarantee you that they're going to take different lengths of time. One's going to give you more trouble than the other. That's just the nature of knee replacements. And so you can't compare yourself to other people. You have other physical attributes and you have other medical issues going on, so try not to get into that game. The second point I want to make on this section is that it's really important for you to manage your pain. You're not going to gain any points by being a hero and suffering through the pain. It's just going to affect your rehab. It's going to go slower. You're going to have a tougher time. So take the recommended amount of medication that your physician allows, and you know, we always recommend when we see a patient in therapy that we'd like to have them take the medication an hour before to make sure that it's kicked in before we start working with them. A third point I'd like to make is that also nothing is gained by trying to advance yourself to a lesser walking aid. So what I'm trying to say here is, like, let's say you're walking with a walker now, and you know, you think that you want to get to the cane because you're going to be doing better. Actually, that can actually slow your progress down. I'd rather have you stay with the walker longer than you think might be necessary, because that'll help your rehabilitation, help get the knee bend and the knee straightened better than you would if you went to the cane too quickly. If you're with a cane, don't advance too quickly to not having any walk or a cane at all. So these are the things you want to keep in mind as you go into your rehabilitation.